Tuberculosis or TB is a serious infectious disease that primarily affects the lungs. It's caused by the bacterium Mycobacterium tuberculosis. When someone with active TB in their lungs coughs, sneezes, or even talks, they can release tiny droplets containing the bacteria into the air. These droplets can be inhaled by others, leading to new infections. It's important to understand it because TB is not just a disease of the past, it remains a significant health issue today. Despite being preventable and curable, TB continues to affect millions of people worldwide. TB can be cured with a proper course of antibiotics, and prevention is also possible through measures like vaccination and public health initiatives. Early detection and consistent treatment are key to controlling the spread of TB. Let's learn more about TB, its symptoms, and how it spreads. Understanding these aspects can help us take the necessary steps to protect ourselves and our communities. Tuberculosis has been around for centuries, with evidence of the disease found in ancient Egyptian mummies. Over time, our understanding and treatment of TB have evolved significantly. It's caused by bacteria, specifically Mycobacterium tuberculosis. These bacteria are highly resilient and can survive in the body for years without causing symptoms, a state known as latent TB. These bacteria usually attack the lungs, causing symptoms like a persistent cough, chest pain, and coughing up blood. However, TB can affect other parts of the body too, such as the kidneys, spine, and brain. TB is a global health concern, with millions of people getting sick from it every year. It is especially prevalent in developing countries where healthcare resources may be limited. Knowing about TB can help us stay healthy and can also stop the spread of this disease. By raising awareness and promoting early diagnosis and treatment, we can work together to combat TB and protect public health. Imagine tiny invaders attacking your lungs. That's what happens when you have TB. The bacteria multiply in your lungs, causing inflammation. Your body tries to fight back by sending white blood cells to the lungs, leading to the formation of nodules called granulomas. Over time, TB can damage your lung tissue, making it hard to breathe. If left untreated, TB can be life-threatening. How do you know if you have TB? There are some common symptoms. A persistent cough is a major sign. You might also experience chest pain. Sometimes people with TB cough up blood. Feeling tired all the time is another symptom. Other signs include fever, chills, and weight loss. If you have these symptoms, see a doctor immediately. Early diagnosis is crucial for successful treatment. TB spreads through the air. When an infected person coughs, sneezes, or even talks, they release tiny droplets that contain the bacteria. If you breathe in these droplets, you can get infected. People with close contact, such as family members, friends, and coworkers, are at higher risk. It's important to note that TB is not spread through touch. Sharing food or drinks won't transmit the disease. Section 5. Treatment options for TB. The good news is that TB is curable. There are effective treatments available. The most common treatment involves a combination of antibiotics. These antibiotics need to be taken for several months. The usual duration is 6 to 9 months. It's essential to follow your doctor's instructions carefully. Directly observed therapy, or DOT, is often recommended. With DOT, a healthcare worker watches you take your medication. This ensures you don't miss any doses. Section 6. The importance of completing treatment. Completing the full course of treatment is vital. This is even if you start feeling better before finishing all the medication. Stopping treatment early can have serious consequences. The bacteria might not be completely eliminated. This can lead to drug-resistant TB. Drug-resistant TB is much harder to treat. It requires stronger and longer courses of antibiotics. It's crucial to prevent drug resistance by completing the initial treatment. Section 7. Interesting facts about TB. Here are some interesting facts about TB. TB is one of the oldest known diseases. Scientists have found evidence of TB in Egyptian mummies. 1/3 of the world's population is infected with TB bacteria. However, not everyone infected develops the disease. People with weakened immune systems are more susceptible to TB. This includes individuals with HIV/AIDS. TB is a leading cause of death among infectious diseases. A vaccine for TB exists, however, it's not widely used and is only partially effective. Section 8. Awareness and prevention. Tuberculosis is a serious public health issue that affects millions of people worldwide. It is caused by the bacteria Mycobacterium tuberculosis, which primarily attacks the lungs but can also affect other parts of the body. Raising awareness about TB is crucial in combating this disease. Public education campaigns and community outreach programs play a vital role in informing people about the risks and symptoms of TB. We need to educate people about the disease, its symptoms, and prevention measures. Prevention strategies include regular screenings, especially for those in high-risk groups, and ensuring that people complete their full course of treatment to prevent the spread of the disease. Getting tested for TB if you have symptoms or have been exposed to someone with TB is essential. Early detection can significantly improve treatment outcomes and reduce transmission. Practicing good hygiene, such as covering your mouth and nose when coughing or sneezing, and regularly washing your hands with soap and water or using hand sanitizer, can help prevent the spread of TB. Ensuring good ventilation in homes and workplaces is another important measure. Proper ventilation helps to reduce the concentration of airborne bacteria, making it less likely for TB to spread. Supporting TB control programs and research is crucial. These initiatives work towards developing better diagnostic tools, treatments, and vaccines, as well as providing support to those affected by TB. By working together, we can reduce the burden of TB and save lives. Collaboration between governments, healthcare providers, and communities is key to making significant progress in the fight against tuberculosis. Section 9. Test your knowledge, a quick TB quiz. Now that you've learned about TB, let's test your knowledge with a quick quiz. This will help reinforce what you've learned and ensure you have a solid understanding of tuberculosis. Question 1. What is the main way that TB spreads? Is it A, through the air, B, through touch, or C, through food and water? Think carefully about how TB bacteria are transmitted. Remember, TB is primarily an airborne disease, so consider which option makes the most sense. Question 2. What is the most common symptom of TB? Is it A, headache, B, persistent cough, or C, sore throat? Reflect on the symptoms we've discussed. Persistent cough is a key symptom, but let's see if you remember the other symptoms as well. Question 3. Why is it important to complete the full course of TB treatment? Is it A, to prevent the spread of the disease, B, to avoid drug resistance, or C, both A and B? Completing the full course of treatment is crucial for both preventing the spread of TB and avoiding drug resistance. It's essential to understand these aspects to effectively combat TB and protect public health. Great job on the quiz!